Hi everyone, and in this video I'll be discussing the bioavailability graph. So most of the questions come from this, and that's why we have taken it as a separate video. Now, what is bioavailability graph? We know that when we give the drug gets absorbed slowly and the plasma concentration increases gradually. So it will reach a maximum and then starts falling down. So if I plot that in the graph, we get a graph called bioavailability graph. So let us do that. In bioavailability graph, let me tell you, first of all, any graph you should understand what is there in the y-axis and what is there in the x-axis. So what is there in the x-axis and what is there in the y-axis. Now let me tell you what is there in the y-axis is the plasma concentration of the drug. Plasma drug concentration is present in this. Okay, so here in the x-axis is the time. For example, this is the 0, 1 hour, 2, 3, 4, 5. Okay, so this is the time. Now what happens when I give the drug? When I give the drug, it will gradually rise. So it will gradually rise. So when we give a drug, the drug slowly rises in the plasma because it's getting absorbed. So it will gradually go up. It reaches a peak. And after reaching the peak, it falls down like this. Now if you look into this graph, it looks like a bell-shaped curve. Now the place where it is maximum, the concentration where you see the maximum concentration of this is the Cmax. So the concentration where we see it is maximum is the Cmax. The time where we see it is maximum is Tmax. Suppose I am taking this as hour. So 1 hour, 2 hour, 3 hour, 4 hour, 5 hour. So the concentration where the drug has achieved maximum is called Cmax. The time where the maximum is achieved is called Tmax. Okay. Now, another important aspect we need to understand here is there is a concentration called minimum effective concentration. Let me draw the line. There is something called minimum effective concentration. So what do you mean by that? Let me tell you. This is the minimum effective concentration. The meaning is only when the drug achieves that level, it will start working. When the drug achieves that level, then only the drug will work. Now here in this example, when the drug reaches this point, so let me take this point. It's around one and a half hours or 1 hour 15 minutes. That is the point where the drug starts working. So we call it as onset of action. We call it as onset of action of the drug. I'll give you a classical example. When I take paracetamol orally, will the fever come down immediately? Never. It takes some time because the drug has to be absorbed and the plasma level should increase. So that's why there is some time for onset of action. So when will the drug start working? When it achieves minimum effective concentration. That much should be there. Now the drug will rise up and reaches the maximum, that is called Cmax. It will reach the Cmax. Now once it is reaching the Cmax, again it will fall down and again it will come below the line. Now when it comes below that MEC, will the drug work after that also? No. When the drug comes below that, then the drug stops the work. Stops working. And the point between this and this, what I am marking now in the white color is what we mean by the duration of action. It is called a duration of action of the drug. So in the future, if I tell you the duration of action of the drug means how much hours it is going to work. If I tell you the onset of action, meaning is after giving the drug, after how much time the drug will work. Take the example of IV. If I give the drug IV, the onset of action is immediate. That's why it is used in emergency. But if I give orally, why the drug will not work immediately? There is something called lag period. Why there is lag when we give orally? The reason is when we give drug orally, it has to pass through the GI tract, get absorbed, then it has to come to circulation and achieve MEC. That's why it takes time. And that's the reason oral is not the emergency route. Now the time to achieve that is Cmax, and The time where we see it is Tmax and the concentration is Cmax. Fine, sir, we understood that. Now, there is one more level. I'll write that. There is one more level. This is the one more level. And what is that level called as? What is that level called as? That level is called minimum effective concentration for adverse effect. Minimum effective concentration for adverse effect. That means if you are giving the drug more, then the graph will go above and patient will have adverse effect. So if you want to give the drug, you have to give this drug within this range. So the range between these two lines is what we mean by the therapeutic window. So the drug should be given within this level only. If you give less than this, it will not work. If you go more than that, the drug will cause toxicity. So that's the reason why the drugs has to be given within this, and that is called therapeutic window. Correct. Now you take an example. You all know paracetamol, correct? We take paracetamol for fever. The dosage for adult is 500 mg. Now, can an adult take only 100 mg? What happens if he takes only 100 mg? The drug viability graph will be like this. So will the drug work to the patient? Never. Why? Can you guess why it is not working? It is not achieving the minimum effective concentration. That's why it is not at all going to work. So that's why we have to give 500 mg. So this is not going to work. The next option is, sir, can we give higher dose? What happens if I give 2 gram or 3 gram of paracetamol? If I give high dose, the graph goes like this. Sir, what happens if the graph goes like this? The patient will have adverse effect. So I cannot give the higher dose. So that's why the dose should be within this range. The dose should be within this range. Okay, so this is what the meaning of bioavailability graph. So we understood the parameters. Let me explain again. When we give the drug orally, it will not be in the blood immediately because it has to pass through the GI tract. But once the absorption increases, the drug keeps on increasing in the plasma, so it will go up. It reaches the maximum concentration called Cmax. The time where it has reached the maximum is called the Tmax. Now, once it has reached the maximum, the drug has to be thrown out, elimination, so it comes down. Now, when will the drug start working? When it achieves the minimum effective concentration, then only it will work. And that is what we mean by onset of action. When will the drug stop working? If it is going below that concentration, it will stop working. What is the duration of action? The point between this and this is the duration of action. Now, what is this MEC for adverse effect? If you give higher dose of the drug will cause toxicity. You have to give within this, and that is called therapeutic window. You cannot give too low dose of the drug, or you cannot give too high of the drug. If you give too low, the drug will not work. It will not produce any effect. If you give too high, the drug will produce adverse effect. So that is about bioavailability graph. Now, once I understand this is a bell-shaped curve, and the area inside this, what I am marking, the bell-shaped curve, it is also called by a name called area under curve. So this is called the area under curve, what I have marked here. So that is called the area under curve. So there are certain questions from this. What are those? What are those? Question number 1. What parameter in the bioavailability graph will give us rate of drug absorption? Rate of drug absorption is mainly given by Tmax. So Tmax is the one which will tell us what is going to be absorbed faster. I will give an example of a graph here. So let me draw the bioavailability graph for you. Let me give a drug A. So drug A, I'll write here. This is the drug A which has achieved the maximum. This is the Cmax for drug A. And this is the Tmax for the drug A. There is another drug B. So drug B has also achieved the maximum concentration. This is the Cmax for that. And this is the Tmax for that drug. This is drug B. Now you tell me from the graphs what do you have here? What is absorbed faster? Obviously the one which takes lesser time, Tmax. So the drug A is absorbed faster. So the major parameter to determine this is Tmax. So if both are given in the option Tmax and Cmax, if they ask you in the exam, what gives us the rate of absorption? Obviously, it is Tmax. Now I'll give one more example. You have a car and you have to reach a destination that is 100 kilometer. This is the destination and you take 1 hour for that. There is one more of your friend who is driving a bike. He will also cover the destination that is 100 kilometer, but he will take 2 hours. Now who is faster? Obviously car is faster, because to cover that 100 kilometer you are taking only 1 hour time. Bike is covering 100 kilometer but is taking 2 hours. So time is the one which tells us the rate. Rate means how much fast. The next important thing is, who will tell us the extent of drug absorption? Extent of drug absorption. That means how much is absorbed. That means how much is absorbed. I told you when I took the example of bioavailability, if I give 500 mg of paracetamol, 400 is absorbed and 100 is not at all absorbed. So extent of absorption is given by the area under curve. So area under curve, which is a bell-shaped curve, is going to tell us the extent of drug absorption. See, these two were asked repeatedly. One is this, and after that another exam this came. Okay, so we understood this. Now let me take another graph here. Okay, what if I give the drug IV? What if I give the drug IV? This is the 0 hour, 1 hour, 2, 3, 4 hour. What if I give the drug oral? What if I give the drug IV? So when I give the drug IV, this is the MEC. This is the MEC for adverse effect. When I give the drug oral, the drug will fall like this. So there is no bell-shaped curve if I give the drug IV. When I give intravenous, you don't see the bell-shaped curve. Why? Because there is no absorption. There is no absorption. What you see is only fall. So this is what we mean by area under curve for the IV route. And what is the onset of action? See, remember the Tmax is 0. That means the drug will work immediately. It will work immediately compared to oral route. Now if I give the same drug orally, you get one more graph like this. So this is the graph for oral route and I will mark like this. So this is the area under curve for oral route. Sir, what we take the advantage of this? This is taken advantage to calculate the bioavailability. So bioavailability is given by the formula area under curve oral or any route. So any route you can take into consideration divided by area under curve IV. Why IV is standard? Because IV has the maximum bioavailability. So it is taken as the standard for everything. Area under curve oral or any route you take, the rectal route or anything, into 100. So that will give us the bioavailability. So what we understood from this is the bioavailability, how to calculate bioavailability for this. So this is the time and this is the plasma concentration of the drug, and the green color is the area under curve for IV route and the bell shaped is for oral route, and you can calculate bioavailability with this. So area under curve oral or any route divided by area under curve IV into 100%. Okay, so we understood this. I will give you one more same graph explanation here. Yeah. So let me draw the graph here. When we give the drug oral, we saw the graph going up and coming down like this. So I told you this is the area. So the inside area is the area under curve. Okay. Now they can ask you why the graph goes up. What is the pharmacokinetic parameter making that graph to go up? The parameter is because of absorption. So if the absorption is more, the drug is also going more. Now once it achieves the Cmax, then it comes down. Why it is coming down? Because mainly the drug is getting eliminated. So the drug is eliminated, that's why it is falling down. So elimination makes it come down. So elimination consists of two parts, the metabolism and excretion of the drug. So they will throw the drug out. So this can be asked. Now this inside is what we mean by area under curve. This is what we mean by area under curve. My question to you all, if you know that the graph goes up because of absorption, comes down because of elimination, if I want to increase the area under curve, can you tell me what should I do so that the area under curve increases, the area increases? Yes, pause the video and just guess it. How to increase that? How to increase that is by increasing the absorption of the drug or by decreasing the first pass metabolism. If the first pass metabolism is decreased, obviously bioavailability is decreases. No. If you decrease the first pass metabolism, bioavailability increases. So by doing that, or by decreasing the elimination. So when you increase the absorption, let me trace the graph like this. When you increase the absorption, it will be like this. When you decrease the elimination, it will also be like this. So the area under curve increases. So this was a question asked in one of the INICT. That's why I'm telling you how to increase this area under curve. Either increase absorption, decrease the first pass, or decrease the drug elimination by reducing the metabolism or by reducing excretion. So these are the things. Yes. So we understood the bioavailability. The last thing in bioavailability you need to understand is a concept called bio. It is called as bioequivalence. It is called bioequivalence. Now, what do you mean by bioequivalence? Now, we have a drug called paracetamol. Suppose another company wants to come with the same drug, paracetamol. We have Dolo 650 and we want to come with one more drug. We already have a Dolo 650 company called Microlabs. Somebody wants to come with another brand, P650. So if you want to approve this drug, your bioavailability should be similar. The Dolo 650 bioavailability and P60 bioavailability should be similar. Now the point to understand here is, now let me draw the graph for this. Now here, this is the minimum concentration for the drug to work. This is the minimum concentration for adverse effect. Now when I take the classical example of Dolo 650, we see the graph like this. Okay. So we see the graph like this. Right. Now another drug which has come to this, it should satisfy the same extent. Suppose the new drug is showing the graph like this. It is absorbing too fast and going like this. Will it be approved? No, because the drug is crossing the limit. Or can I approve a drug which is taking long time to start working? So Tmax is here. Suppose I give paracetamol today and the drug works tomorrow. Will we approve that? No. So when I have to approve this drug, the new drug, to tell it as bioequivalent, it should have almost similar bioavailability. So it can be plus or minus 20% differences. So the rate and extent of absorption should be similar. Rate and extent of absorption of the drug should be similar. Should be similar. It may be a variation of plus or minus 20%. It may be less than 20% absorbed or more absorbed, but not more variation. So this is what we mean by bioequivalence. Now this is done so that we avoid the adverse effect. For example, if the drug is absorbed too much, what happens? Toxicity. If the drug is not at all absorbed, it will not work. Or if the drug is absorbed but it is taking very long time to achieve the onset of action, then also it will not work. So the new drug should have the similar bioavailability. So the rate, that is rate of absorption, the extent of absorption should be similar, plus or minus 20%. Then only we call this concept as bioequivalence. So very, very important. Now the trending question in your exam, very much important. Let me summarize these things. We are dealing with a bioavailability graph. Whenever you think of the graph, think of what is there in y-axis, what is an x-axis. Y is plasma concentration, x is the time. Rate of absorption is given by Tmax, extent of absorption is given by area under curve. If you want to increase the area under curve, you have to increase the absorption or decrease the first pass or decrease the metabolism, decrease the excretion of the drug. Now, another important point is what is bioequivalence? A new drug has to be approved and it should have similar bioavailability, that is, rate and extent of absorption should be similar to the original drug. The variation may be plus or minus 20%. What is the onset of action? It is the time where the drug reaches minimum effective concentration. And what is the stoppage of the drug action when it comes below that? And between that, it is the duration of action. Now, IV route has immediate onset of action because when we give IV, the concentration, that is minimum effective concentration, can be achieved immediately. And that's why it has the fast onset of action. So that is about the bioavailability graph. Thank you all.